Drugs in the Mind, Chapter 8A. Psychoactive drugs may foster some level of psychological or physical dependency on the drug. A psychoactive drug is one that alters one's mood or emotional state. Psychoactive drugs can cross the blood-brain barrier, and they alter communication between neurons by affecting the actions of neurotransmitters. Ways in which psychoactive drugs alter this communication between neurons is they may stimulate the release of a neurotransmitter, enhancing the response of a receiving neuron, or they may inhibit the release of a neurotransmitter, thus dampening the response of a receiving neuron. Psychoactive drugs may delay the removal of a neurotransmitter from a synapse, which is going to prolong the effects of that neurotransmitter. Or these drugs may bind to the receptor of the neurotransmitter that may affect that receiving neuron in the same way as a neurotransmitter prevents the neurotransmitter from acting. Dependence occurs when someone can no longer function normally without the drug. The drug's needed for some type of physical or psychological well-being. Certain drugs stimulate the pleasure centers in the brain, in the limbic system, and encourage its continued use. Tolerance occurs when higher and higher doses of a drug are needed to generate a response. Tolerance develops because the body steps up production of enzymes that typically would break down the drug. Cross-tolerance occurs when tolerance to one drug lessens the response of others, such as abuse of cocaine develops tolerance to other drugs such as morphine and heroin that have similar effects on the nervous system. Alcohol is a legal drug, and alcoholism is America's #1 drug problem. The effects of alcohol on a person's behavior depend on the blood alcohol level. 1 gram of alcohol to 100 milliliters of blood equals the blood alcohol level of 1%. The blood alcohol level is affected by how much alcohol is consumed, how quickly it is consumed, the rates the alcohol is absorbed or distributed, or the metabolism of the consumed alcohol. Alcohol is soluble in fat and water and distributed to all tissues. It can cross the blood-brain barrier. Approximately 20% of alcohol is absorbed from the stomach and 80% from the intestine. If there's food in the stomach, it does slow down absorption and the rate in which it's passed to the intestines. The rate of elimination of alcohol is that the liver converts alcohol to carbon dioxide and water, and the rate of metabolism is about 1/3 of an ounce of pure alcohol per hour. If intake's faster than metabolized, then a person becomes more intoxicated as more alcohol is consumed and continues to circulate in the blood. A woman's body contains a higher fat content than men, and alcohol dissolves more slowly in fat than water, thus its prolonged effect in women. Women lack a stomach enzyme that breaks down alcohol, and women absorb about 30% more alcohol than a man. Alcohol has a negative effect on nearly every organ in the body. In the brain, alcohol acts as a depressant and slows the activity of neurons. It affects the areas of higher cortical thinking. Alcohol affects the balance and coordination centers, and as well as regions of the brain responsible for consciousness, the reticular activating system, the RAS. Excessive amounts of alcohol can cause unconsciousness, coma, and even death from respiratory failure. Approximately 95% of alcohol is metabolized by the body before it's eliminated. In the liver, excessive alcohol consumption damages the liver, which performs many vital functions. In the liver, it can cause the buildup of fat, which reduces blood flow through the liver. It can also cause inflammation of the liver, known as alcoholic hepatitis. And it also can cause the buildup of fibrous scar tissue, in the liver known as cirrhosis, and cirrhosis is the 9th leading cause of death in the United States, which can lead to death. A person who drinks heavily is at least twice as likely to develop cancer of the mouth, tongue, or esophagus as compared to a non-drinker. People who smoke and drink are especially at risk of developing cancer. Heart and blood vessels in moderation alcohols may be good by reducing stress, raising the HDL or high density lipoproteins in the blood, help to reduce the likelihood that blood clots will form when they should not. Pardon me. In excess, alcohol is bad. It weakens the heart muscles and promotes fat depositing in blood vessels that can result in higher blood pressure. This shows the image on the left of a healthy heart, on the right of one of a drinker. Fetal alcohol syndrome, abbreviated FAS, is the 3rd leading cause of birth defects after Down syndrome and spina bifida. FAS, though, is totally preventable. Fetal alcohol syndrome, or FAS, develops among children of women who drink alcohol during pregnancy. Results in growth abnormalities, birth defects, including mental retardation, growth deficiency, and characteristic facial features. Marijuana is the most widely used illegal drug in most states of the United States. Its principal psychoactive ingredient is THC. The THC binds to receptors in brain regions involved in thinking, memory, and motor control. It may help, may help to regulate mood, memory, pain, appetite, and movement. THC in small doses give the euphoria and well-being, and large doses can lead to hallucinations. It does have medicinal uses. In cancer, it helps to induce appetite and lessen the effects of chemotherapy. Can be used to enhance appetite for AIDS patients or patients who are anorexic. For patients with glaucoma, marijuana helps to reduce eye pressure. So they're looking for ways to incorporate the THC in pills and not involve smoking. THC has also been helped to relieve pain in phantom limb pain of individuals who have had their limb amputated. Health-related effects of long-term use of marijuana. Respiratory system experiences the most harmful effects and is caused by the residual material in the smoke, not actually by the THC. Marijuana, as cigarettes, the tar contains cancer-causing chemicals. The carbon monoxide prevents red blood cells from binding to oxygen and carrying oxygen to the body cells and tissues. Air passages become inflamed and breathing capacity is reduced. Health effects to the circulatory system is it causes an increase in heart rate and blood pressure. In the reproductive system, THC is structurally similar to estrogen. In males, THC reduces the levels of testosterone and sperm production. In females, the effects are unclear. Some research has shown that it interferes with ovulation in female monkeys. And some physicians have reported cases of menstrual problems and reproductive irregularities in women who smoke marijuana. Stimulants are drugs that excite the central nervous system, such as cocaine, nicotine, or amphetamines. Cocaine is extracted from leaves of the cacao plant. Methods of taking cocaine are inhaling or smoking. Cocaine interferes with the reuptake of dopamine and causes a rush of intense pleasure, a sense of self-confidence and power. It increases the effects of norepinephrine, which prepares the body for our emergencies, our fight or flight response. Thus, cocaine increases heart rate and blood pressure. It narrows certain blood vessels. It acts to reduce appetite, and it also raises body temperature. Health effects of cocaine is the high is very short-lived and is followed by depression, anxiety, and exhaustion. Cardiovascular, it constricts the arteries, possibly causing heart attack or stroke. Increases blood pressure in the respiratory system. Once the high is over, the respiratory centers in the brain are depressed and breathing can stop. Snorting damages the nose and smoking damages the lungs and airways. Amphetamines are synthetically produced stimulants that closely resembles the body's natural neurotransmitters, such as dopamine and norepinephrine. Meth, crystal meth, is an example of an amphetamine, so these are synthetically reproduced. Its effects is it causes the user to feel exhilarated and confident, last longer than those produced by cocaine. They also suppress appetite and the need for sleep. Tolerance to amphetamines develops along with both physical and psychological dependence. Amphetamines can cross the placenta and affect the developing fetus, so there's an increased risk of premature birth or low birth weight of a baby. Nicotine is a psychoactive drug ingredient in tobacco. It's highly addictive. Activates the acetylcholine receptors in the peripheral nervous system. This increases heart rate and blood pressure, whereas in the central nervous system, it facilitates the release of dopamine and serotonin, which creates those pleasurable feelings and relaxation. Health effects of nicotine: increases the heart rate, constricts blood vessels, increases the stickiness of platelets in the blood vessels, which increases the likelihood of abnormal blood clots, which can lead to a heart attack or stroke. Hallucinogenic drugs alter sensory perception. They produce unusual changes in thoughts and emotions, such as LSD. They act by augmenting the action of serotonin, norepinephrine, or possibly acetylcholine. The health effects of hallucinogenic drugs is that the psychological reactions typically are not especially harmful. Real dangers result from the distortions of reality that may lead to dangerous behavior, such as bad trips of paranoia and depression. Users of ecstasy may dance all night and suffer from dehydration or heat stroke. Ecstasy pills may contain additional drugs with a variety of health effects, including being promiscuous. Hallucinogenic drugs affect the visual, auditory, lead to panic, depression, unusual thoughts or emotions. Opiates are natural or synthetic drugs that reduce pain and anxiety or produce a sense of euphoria. Medicinally important, but have high potential for abuse, such as morphine and codeine. Heroin. Heroin is 2 times more powerful than morphine. Opiates slow the breathing rate. Opiates' mode of action is that they bind to receptors of the body's natural opiates, the endorphins, that give us that sense of pleasure, and the dinomorphins, which function in the perception of pain and fear. Health effects: As previously stated, they slow the breathing rate. Overdose can lead to coma or death. If injected, can inflame the veins and promote the spread of pathogens that can cause diseases such as AIDS, hepatitis, and syphilis.